But let's talk now, though, to Jamie Jenkins, former Head of Health Analytics at the Office for National Statistics. Jamie, very good afternoon to you.
Good afternoon, Mike. You good?
Yeah, very well indeed. It's been quite a busy old few days for the government. They've got a new Secretary of State for Health, Sajid Javid, who starts today. I know you can tell me some things about him, but first of all, let's talk about the stats, because on the front again of the Telegraph today, 58.7% change in 7-day average cases is up 58%, which looks bad, but it's not really, is it?
Well, that's one of the things that a lot of countries will be doing, Mike. They'll be going on websites, looking at international comparisons, seeing these rising cases, which, you know, we have seen that over the past month. But remember now, we've had this vaccine rollout. So, yeah, I've been crunching the numbers to try and work out, OK, should we be alarmed of this third wave? And Sajid Javid says he's going to be looking at the data and making some decisions on whether or not you can ease restrictions on July the 5th. That looks like it's not going to happen. Should have happened on June the 21st, Mike. We know that. But will we get to July the 19th? And we still need to do it. So first thing to remember now is if you look at how many tests we're doing a day, because we test far more people in the UK than they do in some other countries. So you could say that's a positive because you identify cases. You can get some people to self-isolate, etc. But when you compare that to some of our European neighbours, if you're doing far more testing, you'll find more cases. So you're going to have more cases per 100,000. So if you just take the UK, Mike, yesterday we reported over 1 million tests in the past 24 hours. 1 million. And if we go back a year ago to this time last summer, it was 100,000. So we're testing 10 times more people a day than what we were last summer. And a lot of the rise, Mike, is in these lateral flow devices that people in America have said throw in the bin. The FDA there have said they're not very good. And even in Wales, Mike, tell us what's remarkable, because you've got these different tests. You've got the lateral flow tests, which I think school children have been taking dozens and dozens home to go and use. And then you get these PCR tests, which is where they're a bit more diagnostic, etc. And there's still some flaws with those, that people say. In Wales at the moment, they're testing more under 10s than any other age group, which is just remarkable.
Really?
Just testing and testing.
But I mean, an awful lot of the people I talk to, Jamie, in schools and parents as well, say that, yes, there are occasional positive tests, but they're very small in number. And yet we've got over 200,000 kids off school at the moment because they've been sent home.
Yeah, and Mike, we've talked in the past about this, and you've been covering the masks in class. Now, the scientists in Wales have actually started to issue guidance to the Welsh Government to start looking at these masks in class rather than this blanket policy. But so let's go back to this data then, Mike. So we know from the data collection in the past year that 93% of all the deaths have been aged 60 and over. Now, so we know the risk of death increases with age. So I've been looking at the government data that's published every day, same data that Sajid Javid will be able to look at himself today. It's Nicola Sturgeon, Mark Drakeford, all these decision makers. What we've seen in the past, Mike, is we've seen rises in cases. They're generally driven by younger people first. And then what that has happened in the past is we start seeing a rise in people over the age of 60. So the reason that's important to flag up the deaths is you start seeing these rise in the older people, and then you can start seeing basically the rates for older people go up, hospitalizations go up, and then people start kind of dying.
Right.
But what I've been tracking, Mike, is looking at the case rate for the under 20s, 20 to 24, the over 60s, and the rate's just not moving for the over 60s, which will be a key effect of the vaccine. So,
well, you would have thought so, because one of the reasons the younger people are getting more susceptible now is because they haven't been vaccinated, right?
There's that, and obviously the younger people are doing more mixing as because they've been kind of in lockdown for the last year. As soon as they've been able to go back into kind of hospitality, it's just a natural thing to be able to do. So we're seeing these rising cases. The ones people who are most vulnerable aren't rising in cases, but that doesn't cut through when you're talking about the headline figures. So in Germany or in Portugal, you're probably looking at the case figures in the UK at the moment thinking, oh, we better ban all these people coming over. And there may be some legitimate reasons for them wanting to do that if they haven't vaccinated their population as much. But in terms of lockdowns or restrictions in this country, Mike, the data clearly supports that you should continue with the easing of restrictions. We know that fewer people are going into hospital. But even the hospital metric, I've been tracking that the last year, that in itself, Mike's got some flaws, because all it says is how many people are in hospital because they tested positive for COVID.
Right.
Now, as more and more people are going into hospital and catching up over the last year, if there's more people in the population with COVID, you're going to get more people going into hospital with COVID. What they need to start publishing, and there's been some rumours around doing that, is how many people have gone into hospital because of COVID. Now, the death figures, thankfully, are really, really low.
Yeah.
And just, I'll give you one stat, Mike, which doesn't get talked about by Mark Drakeford when he's talking to the press here. there were more deaths linked to COVID in one day in January than every single day since the beginning of April.
Yeah.
Now, one day in January, we're talking nearly 3 months now, Mike, that we've had fewer deaths over a 3-month period. But Mark Drake was the only leader out of Great Britain who hasn't even given a date where he will ease all restrictions.
Right.
So
well,
the
that's
data,
the trouble.
Mike, yeah.
That's the trouble, isn't it? Because they can constantly find reasons not to lift the restrictions if they look for them, and they can find numbers if they wish. For example, I'm told a lot of surge testing has been going on in many of the areas which are supposedly rich in the sort of the COVID variant Delta or Delta Plus, and yet they're finding more people with it because it's concentrated in those areas. But that's not a national picture, and it's not a national figure.
No, I plot a map on my Twitter profile, Mike, looking at the cases. We saw this Delta variant start in the Northwest. As any virus, Mike, it starts spreading out and goes a bit wider. And that's generally what viruses do. But we're not seeing the rise in hospitalisation. So remember, protect the NHS, save lives. That one's not kind of broken the link between the vaccine, etc. Deaths are really low. And if you're looking at deaths, Mike, so, the mainstream media will tell you how many deaths have been reported in the last year, in the last week, or the last 24 hours, how many cases. If you look at the official stats from the ONS now and track flu and pneumonia deaths, which again are respiratory viruses, which are quite deadly, etc., there's 10 times more deaths at the moment from flu and pneumonia. Right. The majority of those will be pneumonia, Mike, where they've been mentioned on the death certificate. If you want to take a more stricter measure where ONS will tell you, look at the death certificate and what was the main cause of the death, there's 4 times as many deaths. Now, imagine the scaremongering if we started putting on the news every day how many people were dying from flu and pneumonia in the last 24 hours who had a positive test. And if you put that into context with COVID, take back to last May, May just gone, Mike, ONS ranked the leading causes of death. And across England, COVID was 24th.
Yes.
In Wales, it was 31st. But yet there still seems all this big hysteria. And the narrative's shifted now, Mike. So I caught a bit of question time last Thursday, and Caroline Lucas was on there. And she started quoting this example of they're moving the narrative now onto long COVID. And of course, I'm sure the virus does cause these issues. But remember, we were there to protect the NHS and save lives. And she quoted an example. Now, I'm sure this is a real example, but she said that there was people who were running marathons one month and in a wheelchair the following month. Now, I'm sure there's probably an example of that, and you've got to feel sorry for the people who are affected. But is that the main thing that's going on? Is that kind of respective of what's really going on across the whole of society? Well, I don't think it is.
And that's the problem. That is the problem. I mean, just looking at the overall deaths, because the Telegraph has now started publishing those, overall daily deaths, all causes, England and Wales, week 23, 1,458. And the number of deaths from COVID out of that is 11. So you're kind of going, well, there's not really any comparison there. But also, they talk about long COVID, and there's never any empirical evidence, as far as I can see, as to what they mean by long COVID. They might have somebody down as a statistic for long COVID who feels a bit weary and who doesn't feel as if they've got as much energy as they used to have. But it's hardly life-threatening.
Well, it's not life-threatening, Mike. People will say it puts a lot of pressure kind of on the NHS if people have to go in and get treated for all these things. But if you just look at the symptoms of long COVID, they're fairly similar to symptoms of kind of anxiety and depression as well. I mean, we've seen a huge increase in that over the last kind of year. So, so ultimately, Mike, it's going to start coming back down to, we just mentioned Sajid Javid and whether or not you should be easing restrictions. So remember now, he's come from the Treasury. He was the Chancellor before the Dominic Cummings fallout with regard to the special advisors. So it's kind of a bit like Cummings wanted Hancock out. So Boris has retaliated by bringing Javid in, kind of thing. But being in part of the Treasury, and he was the business secretary as well, I'm sure, Mike, he's going to start looking at it from a wider lens. And we spent £64 billion on the furlough scheme. That is going to start tapering off. And I've read reports that Richie Sunak doesn't want to extend it. But a lot of that money does go on people who obviously aren't working. But even during the most recent month, Mike, where we've seen hospitality open, £2.7 billion extra was spent on the furlough scheme. And I remember back in the Osborne Cameron days, where I think George Osborne announced, it was all over the media, it was big news, that he was going to invest £2 billion in a year into the NHS. So it just seems to be we're throwing 2 billion a year, 3 billion a year monthly on all of these things. Nobody's talking about it.
No. And meanwhile, people can't see their...
got to come to an end.
Well, meanwhile, people can't see their doctors. You know, I had a call from a guy last week in Wales, funnily enough, who's a taxi driver. He can't get in to see his doctor to get a medical done, so he's not going to be able to renew his taxi driver's licence because the council are demanding that they've got a medical for him. And he doesn't know what to do. I mean, what's he supposed to do?
Well, I've seen reports, Mike, of doctors asking for you to have a negative test before you can see them. But surely the doctors have had the vaccine now.
Well, you would think.
Which would obviously... And isn't that what the purpose of a doctor? If you're ill, you want to go and see them. It's like saying, oh, if you test negative, you're fine. You can come and see me.
Well, this is the thing.
Bonkers,
they don't want to see any sick people. You know, just come if you're well. If you're well, okay then. Well, that doesn't work very well. And the same with the hospitals. Stay with us, Jamie. I've got to ask you a couple of questions about the Freedom March as well. We're going to talk about that. We're going to talk about, as well, the state of the NHS. Because the NHS has been saved for all sorts of reasons. However, it's still not working very well. 0344 499 1000 is the number. Welcome back to the Independent Republican Mike Graham right here on Talk Radio. There was a big Freedom March on Saturday. Richard Tice from the Reform Party actually put a helicopter up to film it. We're talking to Jamie Jenkins right now, former head of health analytics at the Office for National Statistics. It was around about, we reckon, 100,000 people, Jamie, and I think more and more people turned out. Partly because it was quite a nice day, but also partly because there are more and more people sick to death of being preached at by people like Matt Hancock, who quite simply doesn't even follow his own rules.
Well, no, Mike, is obviously you've kind of hit the nail on the head there. That these restrictions have been in place. We've heard data, not dates. We had a date. Then they said they were following the data. Well, the data is not really supporting what they're going to be doing. Ministers not following the rules. I've heard these talk as well about Matt Hancock using his private email. Well, right. If you go back a few years ago, I think Michael Gove got a rap over the knuckles from, I think, a watchdog who was looking at him and doing exactly the same thing here. So
let's talk about where we go from here, because I wonder whether what happens in the future, regardless of what public announcements are made by Sajid Javid, is the compliance factor, I think, for British people now is going to be far less than it was.
Oh, definitely, Mike. I think the public will have kind of be looking at this and thinking, how can we continue with all these restrictions? And Sajid Javid's starting to put some murmurs that he's a bit more liberal than Matt Hancock. He's not going to be looking to do the same kind of restrictions that we've got in place. Now, I suppose one of the concerns, Mike, that have already been talked about is, yeah, we'll have Freedom Day in July and then we'll ease restrictions, get rid of them all. And then we'll start going into the autumn, and we've talked about cases, Mike. Cases will start rising again, and then there'll be all this call, oh, we need to lock down, protect the NHS, etc. Now, if you go back over the last 20 or so years, there's never been a winter where the NHS hasn't been in crisis, Mike. And it's inevitable this year. We're going to have the NHS in crisis. We're probably going to have ambulances backed out of A&E, etc. That's all going to happen. But will it now be, because we've had COVID over the last 24 kind of the months that we've been going on with COVID and there's just all these things going on, is it going to be, oh yeah, let's just do a quick lockdown because we want to protect the NHS? That's going to be the big concern. And will the public tolerate that? I think we've reached the point, Mike, where we've been following the data. We've seen this huge rise in deaths over the last year. It's clearly not there now. You cannot continue to impose restrictions. And it comes back to leading by example. If ministers aren't going to follow the rules, then why should the public?
Well, that's exactly right. And the point is that, as you say, it has happened every year that I can remember, to be honest. And if you were running an organisation where the same problem arose every single year and you didn't do anything about it, you wouldn't stay in a job. You simply would be told to walk away and leave and go and find something else to mess up. But at the end of the day, the NHS isn't working. There is already an overload. It is already overwhelmed because they're not dealing with all the people who need to be dealt with. And by winter, there could be 20 million people on a waiting list.
Yeah, and one thing with the waiting list figures as well, Mike, we've seen them rise obviously dramatically over the last 12 months. But that kind of, everybody's thinking, oh, it's all to do with COVID. The waiting lists were very good before COVID, Mike. Nobody was really talking about the NHS before COVID. I think what COVID has done is it's coming and it's showed how fractured the NHS is and decades of underinvestment. Maybe too many people have been going to A&E. One of the things, Mike, you've been championing this thing about doctors, and GPs reopening. One of the things I'm reading is why A&E's kind of overwhelmed at the moment and people are going is because they can't get in and see their doctor. And that's also been an issue over the last, say, decade as well, where people would go to A&E because they can't get a GP because there's not enough GP places, etc. So I think Sajid Javid's going to have a big plate of work to kind of, not just COVID, Mike. We need a full look at the NHS, how it's been run, from top to bottom. It's clearly not working. And if we don't get that fixed, we're going to just go into lockdown all of the time, the mentality. over the next few years as well, I think.
Yeah, no, I think you're absolutely right. Jamie, good to talk to you. Thanks very much indeed. Former Head of Health Analytics at the Office for National Statistics, Jamie Jenkins, there talking about the stats and what they actually mean as opposed to what the government says they mean. And all the government have really done now is they've managed to keep the lockdown extended. They've managed to infest Europe with the belief that actually our diseases are much worse than they really are, and that the variant is much more dangerous than it really is, and as a result nobody can go anywhere and you can't lift the restrictions until July the 19th. Well, why? If it's all going to be fine on July the 19th, which is literally around about 3 weeks away, why are we not doing it now? That would be my question. Matt Hancock certainly doesn't seem to think it's very dangerous, does he?